Hi there, this is James Braithwaite of Braithwaite Physiotherapy, helping you to move beautifully. And today we're going to talk about the sacroiliac joint, which is the joint right back here between your tailbone and the rest of the pelvis. And it is I call it the other low back pain generator. Now there are a ton of low back pain generators, and you can check all of them out on the internet. Just Google low back pain, you'll see 10,001 different causes of low back pain. But the sacroiliac joint is an underappreciated cause of low back pain. It's relevant in maybe 15 to 25% of cases of low back pain, and that's why we're going to talk about it today. Now there's a lot of different medical treatments for sacroiliac joint pain, and you can check again the internet around some of the injectable medical injections that some people use to help them manage sacroiliac joint pain. We though, because we're physiotherapists, we want to help manage that sacroiliac joint pain using exercise. And the research is pretty clear that the strength training, your glute max and your lats are helpful for helping you to manage at least your sacroiliac joint pain. And the reason for that is that the sacroiliac joint is crossed by fibers from both the glutes, the glute max here, and your lats, the opposite side lats. And I will show a diagram as to exactly why that is. The fibers of both of those muscles cross the joint either directly or through the thoracolumbar fascia to help close down and stabilize the joint. So it's super handy to strength train both of these muscles. So we're going to show you a series of exercises that you can do to help you manage your sacroiliac joint pain. Okay, so here we go. First exercise, you're going to lay down a mat on the ground like so, and you're going to do a simple two-legged bridge. A two-legged bridge looks like so, where you thrust your pelvis up by squeezing your glutes to raise your pelvis to a point where there's a straight line between your shoulders and your knees. You want to really try to achieve that straight line angle. It's hard to get that last 10 degrees of extension, so really work to get that straight line between your shoulders and your knees, as you see me doing right here. You're going to do sets of between 5 and 8 reps of that, 3 sets. If you're really strong and you really want to impress your friends, you can go to a one-legged bridge like this, just like so, which adds in a little bit of glute med and requires, of course, a lot more force out of your glute max as well, because there's only one of them lifting the same amount of weight. So it's a great addition or next step to that bilateral bridge. So you can try the unilateral bridge as well. Same thing, 5 to 7 reps, 3 sets of that. Next, you can come onto a hands and knees. This is called a quadruped position. And you can do a bent knee hip extension, just like so, maintaining a straight line through your trunk. It's a very common fault to try and extend an arch through your low back as you do this exercise. Try to keep it nice and steady through the trunk as you do this bent knee extension, just like so. Again, 5 to 8 repetitions of that, 3 sets. Now, you can do that for the first few weeks. Once you've started to master those exercises, we can add in a quadruped again, hands and knees position, fire hydrant exercise, which is where you raise your leg out to the side, like so. Okay, just like that. And the reason that we do that is, again, it helps us to better recruit glute max fibers. So it's an interesting little exercise. It's like a next step after your extension exercise. A little bit more challenging, and you'll see that when you try to execute the movement. So again, 5 to 8 repetitions of that, 3 sets. Next, we're going to add in a one-legged deadlift. You can set up a weight on a box or a coffee table or a weight bench if you're doing this at the gym. You're going to get in front of your weight and you're going to stand on one leg on the affected side, the side that hurts. And you're going to hinge at your hip like so to touch your hand to the weight. You don't have to pick it up just yet. What you're not doing though is you're not letting the other foot touch the floor as you execute this movement. And you're not bending at the knee. You're not bending at the knee to pick it up. The knee stays relatively straight. You flex at the hip. The hip is the part that's hinging, like so. If you really, once you feel very comfortable with this, you can actually pick up the weight and execute with the weight in your hand. It's a little bit more challenging. 5 to 8 repetitions of that, 3 sets. There's a common pattern here. And last but certainly not least, we want to get in some exercise with our lats as well, because we mentioned that the lats is also an important muscle to strength train here. So what you can do is you can set yourself up sitting on a chair with a resistance band. And you're going to have the resistance band anchored up high so that you can execute a pull down movement. I've got my feet planted firmly on the ground, and I'm going to pull my resistance band down towards my body with my hand ending near my chest wall at the bottom of the movement. My elbow is close to my body. Now, as I do the pull, I'm pushing through the opposite leg. That's going to happen naturally. You'll notice a push through the opposite leg. So you're contracting through both your glute and through your lats. And this will help you to strengthen the latissimus dorsi muscle, the other muscle that through the thoracolumbar fascia crosses that sacroiliac joint. Also an important stabilizer. Counterintuitively, it doesn't seem like something up here would be relevant for something all the way down here. It is. So give that a shot. Also, 5 to 8 repetitions, 3 sets of that. And you can start to build these up over a number of weeks. Start with the first 2 or 3 exercises and then start to add in the other exercises as well as you progress. If you want more details on this and some of the causes and the anatomy and the other medical treatments for sacroiliac joint pain, you can check out the link to the blog article I've written that's in the description below this video, so check that out too. Try these exercises, see how they go for you, and if you have questions about this or any other physiotherapy related issue, please feel free to reach out and ask that question to me. I'd be happy to answer. Until next time, I'm James Braithwaite at Braithwaite Physiotherapy, helping you to move beautifully.